Assalamualaikum and a very good morning to everyone. Welcome to the IMR-SEAMEO Webinar Series 2024. We are delighted to have participants from Malaysia, the SEAMEO network and affiliated countries joining us today. The theme of today's session is Safeguarding Public Health, Unifying Pathogen Wastewater Surveillance and Antimicrobial Resistance under the One Health approach. I am Dr. Nabila from the Environmental Health Research Center IMR, and I will be your moderator for today's session. This webinar series aims to share knowledge, discuss biomedical research, and present our latest research outcomes. Before we start, here are some housekeeping announcements. We will not take questions during presentations, but you may post your questions using the link shared in the YouTube channel. The question and answer session will be conducted after both presentations. An attendance link is available on the YouTube channel for those who wish to receive an e-certificate. And please subscribe to the National Institutes of Health Malaysia YouTube channel for updates on future webinars. Before introducing our speakers, I would like to briefly introduce the Environmental Health Research Center, also known as EHRC. EHRC is committed to research, education, and consultation in environmental and occupational health, with a strong focus on assessing the health impacts of environmental factors. To give you a closer look at our work, please watch this short introductory video showcasing our vision, objectives, key research highlights, and ongoing projects across our three main units. This video provides an insight into how EHRC is contributing to safeguarding public health through innovative research and collaborative efforts. Please enjoy the video. Thank you for watching. Now, we will move on to our main agenda for today. Our first speaker today is Dr. Siti Aishah Rashid, a research officer at HRC, IMR. Dr. Aishah holds a doctoral degree in bioprocess engineering from University Technology Malaysia, where she developed her expertise in environmental bioprocess engineering. She focuses on pathogen detection in environmental sources, including wastewater and air, with special interest in wastewater genomics. Her work includes detecting pathogens like SARS-CoV-2 and other emerging threats. Dr. Aishah has published extensively and collaborates with various stakeholders locally and internationally. She also mentors students, guiding them in environmental virology projects. Today, Dr. Siti Aishah will present on surveillance for disease in community through wastewater-based epidemiology, current issues and future opportunities, discussing the potential of wastewater-based epidemiology for public health monitoring. Dr. Aishah, over to you.
All right. Thank you, Dr. Nabila, for the kind introduction. So basically, my topic today is all about detecting or monitoring pathogens in wastewater. Well, it does things and nobody wants to talk about it or go anywhere near it. But monitoring pathogen traces of pathogens in wastewater actually can provide a detailed picture of the entire community without the limitation and biases of the regular testing methods. So with that, let's move to our first slide here. Okay, in this slide here, present to you is a brief information about importance of having disease surveillance for community health. We know that infectious diseases are a major global health issue, worsened by climate change and growing population, and also increase in resistance to antibiotics. Therefore, surveillance plays an essential role, such as to detect the potential outbreak early and also to assess the intervention effectiveness. However, there is limitation actually do exist for our current surveillance system. This is why an alternative surveillance strategy, like wastewater-based surveillance, working in complementary with the current surveillance system is crucial for tracking how the disease spread in population. So the first question is, what is actually wastewater surveillance? So wastewater surveillance, or also known as wastewater-based epidemiology, is actually the analysis of wastewater, looking for drugs, pharmaceuticals, industrial waste, and also pathogens like viruses and bacteria in wastewater and water supply. However, as for today's topic, we are going to focus on wastewater-based surveillance for pathogen, which means we are looking into monitoring pathogens like viruses or bacteria through wastewater. Let us just go through briefly on the historical timeline for wastewater surveillance. So this technique actually has been used for decades already. So the origin of wastewater surveillance actually begins during the London cholera epidemic on the mid-18th century. So eventually the concepts start to emerge on the 19th century, where wastewater surveillance actually being used to track poliovirus in order to understand its transmission. And this followed by the beginning of its application the beginning of its application during the 2000th century, where wastewater surveillance was actually conducted to monitor and respond to polio outbreak in several countries globally. And the applications of COVID-19, the application of wastewater surveillance actually comes to its peak during the pandemic COVID-19, which I will be explaining about in a little bit more detail afterwards. And after pandemics, wastewater surveillance has expanded globally and has been piloted for and applied to various pathogens globally. So very recently, wastewater surveillance was used to detect diseases like monkeypox, chikungunya, Zika, or even dengue. And countries like United States actually use this wastewater surveillance as their an early warning system or early indicator for diseases like monkeypox, and also Zika, and also dengue. As we started to see now is that we have potentially a small group that we're detecting with high positivity rate and lower testing rate. So wastewater surveillance here has advantages over other surveillance listed here due to its broad-based coverage. So the one with potential advantages is actually the broad-based that is capturing everyone in the population, including the pre-symptomatic, the symptomatic, and also the asymptomatic population. So just imagine being able to test a city or a town with 1,000 or even million of people in it, and also a university dormitory like that have dozens or even hundreds of students in it, all busy, or a busy airport, all in one pool sample. So our wastewater surveillance actually, our wastewater systems actually allow us to do this. If talking about a high-risk environment or high-risk settings like prisons, these overcrowded spaces actually speed up the spread of pathogens and increase the risk of outbreak. If you talk about the COVID-19 infections, social distancing is actually nearly impossible to be nearly impossible in these overcrowded cells and shared area, making it difficult to control the viruses. Moreover, the access to the regular clinical testing is limited. So this is why wastewater surveillance is a potential population level approach to monitor pathogens in community. All right, as we started to see now in this slide is that there are actually more than 25 pathogens family that has been monitored in through wastewater surveillance globally. So it can actually be categorized into infectious disease of international concern and also greatest burden of disease. But wastewater surveillance actually commonly used to access the waterborne or water-related pathogens that cause diarrhea. But it can also be used to detect other pathogens like including poliovirus or even those that are not typically designated for waterborne or water-related, such as SARS-CoV-2, influenza, and even malaria. But what I want to focus is that a pathogen family that has been highlighted in red. This pathogen family actually cause infectious disease of public health concern that is actually listed in our 12th nation plan. So from that, we know that wastewater surveillance actually has the potential and has been used to monitor infectious disease in the population level. So talking about the advantages of having this wastewater-based surveillance. So actually it's really effective, especially for viruses like SARS-CoV-2, where the shedding of viruses occurs before the symptom appears. So it really can work as an early indicator and has the ability to correlate the prevalence of viruses in the prevalence of the pathogens in the wastewater with symptomatic patients. Okay, and another interesting aspect that I think is that wastewater surveillance is a better indicator for asymptomatic spread. So if think about it, in the case of COVID-19 infection, most of our cases come from clinical setting where symptomatic individuals get tested. But how about the asymptomatic individuals that could be spreading the viruses? And wastewater surveillance actually can identify that. Another interesting aspect on the advantages of wastewater surveillance is that it provides a multi-scale epidemiological information ranging from the community, residential community to metropolitan level. So it also indicator of community level vaccine effectiveness. Another aspect that wastewater surveillance is really effective in high-risk settings like prisons, and is actually non-invasive and cost-effective methods. Well, in this slide here is actually what I want to show you is about 7 important steps, 7 more most important steps for detecting pathogens through wastewater surveillance. Okay, basically because there are fecal shedding occurs during a certain infection of pathogens, so we can actually trace the viruses or the pathogen traces in the urine and stool that is going into wastewater. So the samples will then be collected either at the wastewater treatment plant in the community level, or we can also collect it from the manhole locating nearby residentials or in the university settings, and then it will be sent to the laboratory for analysis. So for downstream analysis, like doing the matrix recovery controls, sample concentration and extraction, DNA and RNA extraction, viral determinations, and also data interpretations. So let us now talk about specifically on the successful story of wastewater surveillance. In 2020, pandemic COVID-19 actually has bring wastewater surveillance into mainstream attention. Talking about the importance of having COVID-19 wastewater surveillance is that there is an increased realization among the scientific and also the medical community that we're not going to be able to test everyone in the community for COVID-19. The logistical barrier is just too high. So for effective surveillance strategy, we need a way to detect COVID-19 in community that is both accurate and easily deployable. So this is where wastewater testing comes in. Through wastewater surveillance, we can actually accurately quantify the amount of viruses in population that is comprised of both the symptomatic and also the asymptomatic populations. So this slide here actually shows that almost 46 countries globally has conducted SARS-CoV-2 wastewater surveillance. So the regions with the darker brown actually reflecting to us that this area was conducting SARS-CoV-2 wastewater surveillance very heavily during the pandemic years. So it was led by North America, where more than 75 studies was conducted at that particular region. And the least SARS-CoV-2 wastewater surveillance study was conducted in the African continents, where about just 7 wastewater surveillance study was conducted. This is all measured by the number of articles being published. If we look at the Southeast Asia region, where our countries are located, our neighboring countries like Thailand and also Singapore, they actually conducted wastewater surveillance during the pandemic years. But Malaysia is actually catching up. Through Environmental Health Research Center of IMR, we're actually conducting SARS-CoV-2 wastewater surveillance during starting the 2022. So as we can see now, 2021 actually witnessed the highest study conducted on SARS-CoV-2 wastewater surveillance, which is being led by the North America continents. So most of this study actually the focus area of SARS-CoV-2 wastewater surveillance study during pandemic is actually focusing on trends monitoring of the SARS-CoV-2 variant in the population. It also look at the functions of wastewater surveillance as an early warning system or early indicator. Another aspect is that you're trying to correlate the virus prevalent in wastewater with the positive COVID-19 cases to see the correlations. And to the most advanced application of wastewater surveillance is that for variant determination as well as for mutational analysis. Well, another proactive effort that which has been done to empower wastewater surveillance during pandemic is that there has been an initiative to develop a website known as COVID-19 Wastewater Surveillance Collaborative. So this website is actually to empower collaboration on global scales for SARS-CoV-2 wastewater surveillance. And in this website, actually there is a dashboard namely as COVID-19 dashboard, where it sounds like funny, but This dashboard actually provides us with information on how many sites, how many universities, research institutions, private labs, or countries that are heavily involved in wastewater surveillance for SARS-CoV-2. If we are to look at the map here, we can actually see our country participations in wastewater surveillance activities and also our neighboring countries. Okay, please do visit this website just now because it's really interesting to look into. So another initiative to empower wastewater surveillance during the pandemic COVID-19 is that from GZ8. So GZ8, previously before pandemic, they actually shared the genome sequence of influenza virus for from animal and also human samples. But during the COVID-19 pandemic, they actually developed of entries from wastewater surveillance. So this is highlighting the role of wastewater surveillance in genomics area, which has been made for the first time for the development of entry from environmental samples like wastewater. And now if we are to talk about the key challenges of wastewater surveillance, well, I can actually summarize and also highlight these 4 points. The first one is concerning the guidance concerning the selection of pathogens for wastewater surveillance. So basically, we actually want to target something that is of public health concerns. For the second part is that the analysis related uncertainties, okay, especially pertaining the laboratory method, which is about the concentration and extraction methods, because we have like plethora and various of concentration and extraction methods available in the market or in the literatures, but each and every pathogens or viruses, they have different morphologies, different physiologies, and different genomics characteristics. So this different characteristic and its unique characteristic actually needs different concentration or extraction methods. So this is the major bottleneck of wastewater surveillance activity. And talking about sample detections and quantifications, we know that qPCR is the gold standard. However, looking into the complexity of the wastewater metrics, which harboring a lot of inhibitors, a lot of heavy metals, detergents, and whatnot, a lot of complex materials in wastewater. So we need a more sensitive, a hypersensitive, specific detections instruments better than qPCR. And nowadays we have this digital droplet PCR and also digital PCR to cater with this complexity of wastewater surveillance. And another important aspect in the challenges for wastewater surveillance is that sampling and storage condition, where for sampling we have like a few choice of sampling. We can have direct sampling, composite sampling. All this depends on the our resources and also the availability of our resources and the objective. But however, composite sampling actually will be able to tell us about the dynamics of the pathogens load in a sample. Sampling frequency and location also plays an essential role, which is this is one of the challenges where how many times we want to samples a week. Is it 1 day, 2 days, 3 days, or each and every weeks, each and every days of the week? So that is something to be taken consideration for. And storage plays a very essential role because wastewater matrix actually contains a lot of detergents and other harmful materials that could be degrading these genetic materials like DNA and RNA. So storage of these samples will actually plays an essential role. We need to take extra consideration, putting extra additional preservatives or storing it at particular temperature. And the best is that conducting all the downstream analysis right after sampling. So the last point that I would like to emphasize is that it is unknown whether different methods are more or less sensitive for different pathogens. Like I mentioned earlier, different pathogens have different morphologies, different physiologies, and genomics characteristics. So one method for one pathogen cannot be readily suited for another pathogens. Like methods for SARS-CoV-2 cannot be used for detections of dengue viruses. All right, so here we come to our main point here today is that about the efforts conducted by Environmental Health Research Center of IMR on conducting the SARS-CoV-2 wastewater surveillance study. So actually this project was commenced during the 2022 and just completed during the July 2024 this year. So this study actually wants to assess the usability of wastewater surveillance to monitor COVID-19 in institutional and also the community settings. So our study was conducted in institutional level, which is located in one of the prison in Selangor, and also 2 wastewater treatment plant that is located in one high prevalence cases area, and the other one is in low prevalent cases area. So we just want to see whether this wastewater surveillance, the method that we've been trying to develop, is it sensitive enough to detect in a low prevalence area and also in different sewage systems like prisons. So what we found that from our finding is that we highlighted 3 important uses of wastewater surveillance. If wastewater surveillance was conducted at a community level, like wastewater treatment plant, it will actually provide a situational awareness, such as it will be able to detect the potential outbreak early. And the second point is that wastewater surveillance is actually very effective to be used to monitor COVID-19 in high-risk environment or high-risk settings like prisons, where despite the very few positive clinical cases that has been diagnosed in one of the prisons, we actually managed to detect multiple pathogens in the sewage system throughout the study period for about 7 months. So this actually indicates that wastewater surveillance has the potential and able to detect a healthy carrier or even the underreported cases of COVID-19. And the last important point that we actually got from our finding is that it's actually provide an early warning system, as what one of the studies previously conducted by the United States, they actually use this as an early warning system or early indicator. And if wastewater surveillance is to combine with the genomic surveillance, we will be able to track variant of concern in circulating in that populations, even with the absence of clinical testings. So this is actually the 4 main important steps that we are conducting wastewater surveillance by our team, which is the main point is that sampling. We use multiple methods to see which method will give the best representative, and also RNA extraction. We actually do use a clever concentration method, which is actually combine extraction and purification all in one step. It's a high throughput method. And also quantification and detection, we opt for digital PCR, a more sensitive and hypersensitive detection methods, and also sequencing. So we actually able to successfully develop a protocol for SARS-CoV-2 detection and quantification that will expedite the process for from sampling to DNA quantification and detection for about 12 hours. So I would like to show you our video here about our activity throughout our projects for 2 years. The sampling processes conducted in one of the prisons. This is our dedicated team. You're going to the sampling site each and every day without miss. They have very good analytical laboratory capabilities, doing multiple samples at one time, using adapting to the high throughput technologies and sequencing the virology units are very extremely important collaborators in our team. And this is our team. All right. And then okay, what I want to focus now before we end is that what we are trying to focus for wastewater surveillance in future, for lesson learned from what we have conducted and from the literatures, we try to enhance wastewater surveillance in these three main areas. The first part is the field sampling. So field sampling is very crucial. So we hope that in future we'll able to develop solution to sample at high density premises, even at the airport. And for laboratory analysis, this is a crucial part, which is a major bottleneck. So we hope from the study that we have conducted, we actually able to develop a protocol that actually expedite the overall processes. But in future, we are looking into multiple pathogens of detections through wastewater surveillance, and we try to have the capability of our laboratory analysis for point-of-care detections at sites. And also data analysis is actually extremely important. So by generating the automated script for results generation and interpretation, we hope that we can able to deliver the results, deliver the information about the early outbreak as soon as possible. So to summarize, wastewater surveillance is actually a valuable population-level approach for monitoring pathogens in populations. So just imagine being able to test a city or even a town with 1,000 or even million of people in it, all in just one pool samples. So our wastewater system allows us to do this. With the combination with genomic surveillance, we actually can track the variant of concern circulating in the population, even with the absence of clinical surveillance. So last but not least, we hope that wastewater surveillance can be used to monitor other infectious diseases of public health concern. It can be the neglected disease like dengue or even influenza and even malaria, both in the institutional and community setting. So as we know, surveillance is very, very important, including for the asymptomatic population that could be spreading the viruses. So with that, thank you very much.
Thank you, Dr. Aishah, for your insightful presentation. Dr. Aishah discussed the role of wastewater-based surveillance as a critical tool for monitoring infectious diseases in communities. She highlighted the historical evolution of wastewater-based surveillance, its application during the COVID-19 pandemic, and its potential to track emerging pathogens such as monkeypox, chikungunya, and dengue. Dr. Aishah also emphasized that wastewater-based surveillance offers broad-based coverage, capturing data from asymptomatic, pre-symptomatic, and symptomatic individuals, making it an early warning system that is non-invasive and cost-effective compared to traditional clinical surveillance methods. If you have questions for Dr. Aishah, please submit them using the link provided in the YouTube channel. Now we move on to our second speaker. Our second speaker is Ms. Yuvaneswary Veloo, a research officer at EHRC with over 10 years of experience in microbiology, infectious diseases, molecular biology, and occupational health. She has significantly contributed to research on antimicrobial resistance in various environments, particularly dairy and poultry farming. Ms. Yuvaneswary holds a master's degree in environmental studies and has been recognized for her work with numerous awards and publications. She uses a One Health approach in her antimicrobial resistance research, bridging human, animal, and environmental health. Today, she will share her insights on antimicrobial resistance and its impact on public health. Her presentation is titled Addressing Antimicrobial Resistance in the Environment Through the One Health Concept. Ms. Yuvaneswary, the screen is yours.
Thank you so much, Dr. Nabila, for your kind introduction. A very good morning to everyone. It is an honor to speak to you today about a topic that has huge impact on public health, animal health, and the environment, antimicrobial resistance. My topic today is addressing antimicrobial resistance in the environment through One Health concept. Antibiotics. This is a familiar word to most of us. Many of us have taken antibiotics to recover from illness. Antibiotics are medicines that help us to fight infections caused by bacteria. Antimicrobials, on the other hand, covers a broader range of pathogens, including bacteria, virus, fungi, and parasites. Therefore, we can say all antibiotics are antimicrobials, but not all antimicrobials are antibiotics. Antimicrobials are widely used in various sectors. As we are well aware, antimicrobials are used in the human healthcare, such as in hospitals and clinics, to treat infections caused by bacteria. Then we use antibiotics. If fungi, then we use antifungal, virus, antiviral, and parasites, antiparasitics. Besides that, antimicrobials are also used as a surgical prophylaxis, which means they are given before, during, or after a surgery to prevent infections. Other than that, antimicrobials are also used to prevent or treat infections in the immunocompromised patients, such as those who are undergoing chemotherapy or those who are with HIV or AIDS. Now coming to animals, antimicrobials are used as a veterinary medicine. Antimicrobials are used to prevent and treat infections in the animals. In some places, antimicrobials are used as a growth promoter, whereby it's being added in the animal feed. Next will be on the agriculture and aquaculture. In agriculture, antimicrobials are used for crop protection, and for aquaculture, it is used to prevent and treat infections. In food production and processing, antimicrobials are used to prevent the food products from getting spoiled or contaminated. Last but not the least, in the environmental settings like water treatment, whereby antimicrobials are added to kill any harmful microorganisms and to ensure that the water is safe for consumption. This clearly shows that antimicrobials play important role in controlling the infections and maintaining the safety. However, the widespread use of antimicrobials lead to the development of antimicrobial resistance, AMR. AMR occurs when the antimicrobials are no longer effective against the microorganisms. Therefore, the treatments become ineffective, the infections persist, and they can spread to the others, causing the illness to increase and potentially death. According to WHO, AMR is one of the top 10 global public health threats to humanity. This is because it can affect the effectiveness of the antimicrobials, including the antibiotics, making it difficult to treat infections in public, in humans, animals, and also the plants. If never act, it is estimated that 10 million deaths can occur annually by 2050 due to this AMR, and also $100 trillion loss, accumulative loss to the global production. This brings us to One Health concept. One Health concept is a holistic approach that recognizes the interconnectedness between human, animals, and the environmental health. One Health emphasizes that the health of the people is very much related to the health of animals and also our shared environment. However, my focus for today will be on the environmental health. Environment plays important role in the spread and also in the evolution of the resistant bacteria. Environment can act as a reservoir or source for the AMR. It can occur through various pathways. For example, from the hospital and community, animal husbandry, aquaculture, industry, and wastewater. The misuse of antimicrobials will lead to the release of these substances entering the soil and water system. For example, in human and industry waste, including the pharmaceutical residues, which will eventually end up in the wastewater treatment plants. However, not all the time the plants are effective in eliminating the antimicrobials and the resistant bacteria, which will eventually be released into the rivers, lakes, and also the coastal water. Another example is on the animal husbandry. Let me explain in details how this antimicrobial usage can actually affect our human environment and environmental health. When antimicrobial agents are being used in the poultry or livestock farms, it is being used as a treatment and also as a growth promoter. The misuse and overuse of these antimicrobials will cause the resistant bacteria to spread from the animals to the workers through direct contact. Besides that, the resistant bacteria can also spread through the food products, whereby it is causing risk of infections to the people. Antimicrobial resistance can also spread from the manure. Manure is something that is being used as a fertilizer in the fields, and it can alter the community of the antimicrobial, and therefore it can spread to the plants and eventually end up into our food chain and contaminated crops. So rain or irrigations can also cause the antimicrobial residues, the resistant bacteria, to enter the waterways, and it causes the water contamination. The contaminated water will then be used for the animals, crops, and human for consumption. So through this we can see that it is very much linked between one another from human, animals, and also the environment. Looking at the seriousness of AMR, our team, we have conducted studies on the prevalence or the presence of antimicrobial resistant bacteria in the poultry and livestock farms surrounding environments. This is a preliminary study, and the process here shows on how the sampling and also the laboratory work was conducted. First, the soil and effluent samples were taken from various sites from within the farm, and then all the samples were then transported to the laboratory for the analysis. In the laboratory, serial dilution was conducted, and then the culturing of the bacteria, the selective bacteria, was done using the selective media, agar. All the isolates were then gram stained to identify whether it is a gram negative or gram positive bacteria. And finally, using the Vitex2 system, a latest technology, one of the recent technology, the identification of bacteria and susceptibility testing was conducted. These are the pictures that actually shows how the sampling was conducted in the farms. We can see here that for the effluent samples, the effluent were taken from the drainage or the pooled water. And then for the soil, it was taken near the coops and the barns area within the farms. In the laboratory, we can see here that the serial dilution was conducted for the soils and the water, the effluent water, and then the culturing was done for the bacteria using selective media agar, whereby we can have the preferred or our interested bacteria. And this is the Vitex2 system, whereby the AST card or the gram negative or gram positive card will be used for the testing. These are some of the findings from our studies. This graph here shows the percentage of resistance of Escherichia coli based on the types of antibiotics. Based on the results here, we can see that for both dairy and poultry farms, the resistant patterns for all the antibiotics are very much similar. However, For poultry, it shows higher resistance for all the antibiotics compared to the dairy. Besides that, for the types of antibiotics, we can also notice that the ampicillin sulbactam, and trimethoprim sulfametazole, all these three antibiotics showed higher resistance for both dairy and poultry farms compared to the rest of the antibiotics. This is another pie chart which shows the number of isolates, E. coli isolates with the multi-drug resistance. Based on the results here, we can see that for poultry, the number of isolates with multi-drug resistance are higher compared to the dairy farms. These are some of the reasons that can be behind these findings. First is the intensive farming practices of the poultry industry. Poultry industry is the primary agriculture sector in Malaysia, contributing to 62.9% of the total gross domestic products for the animal farming industry. In comparison, dairy industry in this country is not that significant. The other key factors are the shorter production life cycle for the poultry. Chickens, for example, it has a very short life cycle. From hatching to slaughter, it can be as short as 6 to 8 weeks. Therefore, antimicrobials are used frequently during this short window to ensure that the birds stay healthy and it grows faster. Dairy cows, on the other hand, it has a longer life shelf and it has extended production periods. Therefore, the necessary to use antimicrobials are lesser for the administration. Poultry industry might also use a wider range of antimicrobials, including those that are critical for the human medicine. This broad spectrum use of antimicrobials can lead to the promote the development of resistant bacteria. In dairy industry, on the other hand, the range of antimicrobials used tend to be more restricted, only focusing on the specific diseases such as mastitis, and therefore the range of antimicrobials are lesser. Other factors that can contribute is that the antimicrobials are being used as a prophylactic and also growth promoter, because the farmers try to prevent the outbreak of the diseases that can happen to the birds. Therefore, to effectively address antimicrobial resistance through One Health concept, it is important to have integrated approach involving various sectors from various regions. First will be on the surveillance and monitoring. Surveillance system is actually critical for the early detection of emerging antimicrobial resistant patterns. By continuously having the monitoring data from the healthcare settings, veterinary medicine, and besides that, the next will be on the reducing antimicrobial or antibiotic use in all the settings. By reducing the usage, eventually we can reduce the occurrence of the antimicrobial resistant bacteria. Improving waste management includes the management, having a better management to eliminate the antimicrobial waste and residues. Besides that, we also need effective wastewater treatment plants whereby it can reduce the concentration of the residues and resistant bacteria. Next will be on promoting research and innovations. More research focusing on the genomic surveillance, data analytics, development of new antimicrobials, and also the rapid diagnostic kits are needed so that we can have a better control and strategies solution to solve these issues. Besides that, we also need to have a continuous education and awareness program to educate our healthcare providers, the farmers, and also our publics on the responsible use of antimicrobials. Last but not the least, this is not something that can be handled by an individual. Therefore, the governments and the organizations, globally, they need to collaborate and share their resources and expertise in handling these challenges. In conclusion, we can say that environment plays important role in the antimicrobial resistance. Without addressing the environment component, the efforts to combat antimicrobial resistance in the human and also animals alone will not be sufficient. One health approach actually highlights the inseparable link between the human, animals, and the environment. Therefore, we must implement a robust environmental policies and practices to reduce this antimicrobial resistance. International partnership and shared responsibilities are important to safeguard both this environment and also our public health. These are the references I used throughout my presentation. And with that, I would like to thank you all for the listening. Thank you so much.
Thank you, Ms. Yuvaneswary, for sharing your research findings. Ms. Yuvaneswary, she discussed the antimicrobial resistance and its environmental impact through the One Health approach, which connects human, animal, and also environmental health. She explained how antimicrobials are used in healthcare, veterinary medicine, agriculture, and also other settings, which can contribute to antimicrobial resistance. Emphasizing the need for a comprehensive approach, she highlighted strategies such as enhanced surveillance, improved waste management, responsible antimicrobial use, and also international collaboration to address antimicrobial resistance effectively while safeguarding public and environmental health. If you have questions for Ms. Yuvaneswary, please submit them using the link provided in the YouTube channel. Okay, now we will move on to the question and answer session. If time permits, we will address as many questions as possible, and any unanswered questions will be followed up by our speakers via email. Okay, it seems like we have a few questions. The first question is from Dr. Nick. I think Dr. Aishah is the best person to answer this question. The question is, how is pathogen wastewater surveillance more non-invasive and cost-effective compared to clinical surveillance? Dr. Aishah?
All right. Thank you, Dr. Nabila, and thank you, Dr. Nick, for the questions. You're explaining about how wastewater surveillance is more cost-effective and non-invasive compared to clinical surveillance. Well, I would say that for clinical surveillance to be conducted, it needs like a lot of individual samples in order to have the surveillance power. So this is where the costs come from, because wastewater surveillance, it only needs a single wastewater samples to have the whole community information. So we can see the cost effective in this area here pertaining to the samples that representing the surveillance power between the clinical surveillance and wastewater surveillance. Yeah.
Thank you for the insightful answer, Dr. Siti Aishah. Right. We have a few other questions. I think this one is better suited for Ms. Yuvaneswary. The question is, how can wastewater management help reduce antibiotic resistance? Ms. Yuva, if you'd like to answer.
Thank you so much for the question. Okay, as I have mentioned earlier, wastewater surveillance system is actually very much important in reducing the antimicrobial resistance and also the resistant bacteria and also the residues. As mentioned by Dr. Aishah previously, it can actually capture early detection of any new presence of resistance. And for antimicrobial resistant bacteria, we can see that by early surveillance, we can actually identify any new presence of resistant bacteria. Besides that, for wastewater management, it is important to have an effective treatment plant, because through that, then we can remove any antibiotics or any resistant bacteria in advance before it end up in the environment. When it end up in the environment, that's when we have problems whereby it can spread to the animals and also humans. So therefore, the wastewater actually plays important role to ensure that it can be removed in advance before it enters the environment. So we can say first is by reducing, having a effective treatment plan, and second is by continuous monitoring. We can have monitoring in the, let's say, in the community, as well as in hospital base, or wherever we find it is important to actually to detect any early sign of emerging resistant bacteria. Thank you.
Thank you, Ms. Yuva. So to recap, Ms. Yuva mentioned about the importance of having an effective wastewater treatment plant and also monitoring both in communities and also the healthcare system. We have another question. I think this one is meant for Dr. Siti Aishah. The question is, how can I find guidance on selecting pathogens for wastewater surveillance? And Dr. Siti Aishah, if you would like to answer.
All right, thank you again, Dr. Nabila, and thank you again to the one who addressed this question. Actually, I anticipate these questions because so what is the guidance or the guidelines on selecting pathogens to conduct wastewater surveillance? Actually, we can highlight a few points for selecting those pathogens. If I can have, the first one is that pathogens that have epidemiological relevance enough to warrant a public health issues. In short, I can say that some things or pathogens that can make a country jump, like like SARS-CoV-2 previously pandemic and COVID-19. So these kind of pathogens actually worth doing wastewater surveillance. And also, the second point is that to select pathogens for surveillance is it must have microbiological evidence. It must be detected in wastewater and have high concentration enough to be detected by our available methods. Last one is practical feasibility. We have to have enough manpower, and also have we have to have enough technologies to detect that. Yeah, that's my 3 points. Answering that question. Thank you.
Thank you so much, Dr. Siti Aishah, for the answer. We are running out of time, and we only have one more question. And the last question is from Olive, and this is addressed to Ms. Yuva. The question is, how should meat and fish that have been treated with antibiotics be managed? Ms. Yuva, if you'd like to answer.
Okay, thank you so much for the question again. Okay. Actually, managing meat and fish that is already being treated with antibiotics, that's kind of slightly tricky. Okay, of course, it's better to actually have try to consume products that is antibiotic free. If we have no limitation in terms of money wise, of course we can go for the antibiotic free meat. Let's say if that's not possible, then the next option will be making sure that all the meats, the fish, are cooked properly. The raw meat is not advisable to be consumed because it's not something that is safe to be consumed. Okay, the next one can also be true by preventing cross-contamination. Try not to have the cutting boards when we use for meat, try not to use it for the vegetables as well, because through that we can actually encourage any kind of cross contamination, and it can spread the resistant bacteria. So we can say prevent the contamination, be careful with what we are using or the pot and everything, and then make sure it's being cooked properly. And if it's something that it can be done, try to have the antibiotic free meats. That is the best we can do to actually reducing the risk of the antibiotics. Thank you so much.
Thank you so much, Ms. Yuva. So Ms. Yuva mentioned something about having the meats properly prepared to prevent antimicrobial resistance, and also, if possible, to get good quality meat as well. Actually, we do have time for another question. The last one is actually addressed to Dr. Siti Aishah, and Olive from Cagayan State University has asked this question. What are the key methodological considerations when sampling wastewater for both pathogens and also antimicrobial resistance?
All right. Thank you for the questions. So I'll go quickly. So the key methodological consideration for sampling wastewater for both pathogens and AMR. So the important part is that the practical feasibility. We must know we have sufficient human and lab resources or not, including a specific molecular assay, well-designed oligonucleotides and sequencing facility. We must make sure that we have all these facilities and the human resource available. Then let's go for wastewater surveillance.
All right, so the key point from Dr. Aishah's answer is to have a facility and human resource. That is the key to having an effective wastewater-based surveillance. Folks, I think that's all the time we have for today. Thank you so much to our speakers and participants for making this session a success. We hope today's presentations have sparked interest and potential collaborations in public health research. Don't forget to subscribe to our YouTube channel for updates on future webinars. We look forward to seeing you then. Until then, thank you, stay safe, and goodbye.